In Part B of Section 4 of Module 1 about Social Determinants of Health (SDO), we will talk about population-specific impacts, intersectionality, and equity-focused policy strategies. Social determinants of health (SDO), including economic, educational, environmental, and social factors, are foundational drivers of health inequities. Effective, equity-focused interventions must be tailored to the unique needs of children and youth, older adults, and marginalized T-minority groups, while addressing the compounded risks arising from intersecting social identities. Upstream, multi-sectoral, and community-driven strategies are essential for advancing health equity. Social determinants of health (SDO) significantly shape the cognitive, emotional, and physical development of children and youth, influencing educational achievement and long-term health. Children in single-parent, low-income, or minoritized households face higher risks of food insecurity, mental health challenges, and adverse childhood experiences (ACEs). Effective policies like universal early childhood education, e.g., Head Start, improve lifetime health and economic outcomes, particularly for disadvantaged children. Income supports, such as the Earned Income Tax Credit (ITC) and Child Tax Credit (CTC), lift millions of children out of poverty and enhance health. Additionally, integrated services like school-based health centers (SBHCs) improve healthcare access and reduce disparities. Addressing these factors is essential for fostering equity and better outcomes for vulnerable populations. Older adults face increased risks of social isolation, chronic disease, and barriers to healthcare and transportation. Women, racial ethnic minorities, and individuals with disabilities experience compounded disadvantages due to intersecting identities. Effective policies include aging-in-place supports, such as affordable housing and home modifications to help older adults remain in their communities. Expanding Medicare and Medicaid and transportation services improves healthcare access and reduces financial strain. Social inclusion programs like senior centers and intergenerational initiatives enhance mental and physical health. Marginalized and minority groups face compounded challenges due to structural racism, discrimination, and historical inequities, which worsen exposure to adverse social determinants of health (SDO). Effective policies include enforcing anti-discrimination laws, conducting racial equity impact assessments, and engaging in reparations discussions to address systemic root causes. Investments in environmental justice, such as reducing pollution and improving housing in underserved communities, alongside culturally competent care through workforce diversity and tailored interventions, can significantly improve health and equity outcomes. Intersectionality acknowledges that overlapping social identities such as race, gender, age, and socioeconomic status amplify exposure to adverse social determinants of health (SDO) and related risks. Effective interventions must apply intersectional frameworks to prevent perpetuating inequities. For instance, Black older women experience compounded challenges from racism, sexism, and ageism. Culturally responsive, community-engaged, and data-driven approaches are essential to address the needs of diverse populations. Strategies to address social determinants of health (SDO) require multi-sectoral partnerships, community engagement, and equity-focused policies. Health in All Policies (HEAP) integrates health considerations into policymaking across sectors like housing, transportation, and education, improving access to healthy foods, safer neighborhoods, and transportation for marginalized groups. Accountable communities for health (ACH) foster collaboration among health systems, schools, and community organizations to address SDO collectively. Community-based participatory research. CBPR empowers marginalized communities in policy design, ensuring cultural relevance and effectiveness. Participatory budgeting allows communities to drive equitable resource allocation. Equity-focused interventions such as SNAP, Medicaid expansion, and anti-discrimination policies reduce disparities across SDO domains. Addressing structural racism through anti-redlining enforcement, racial equity impact assessments, and reparations further promotes health equity. Standardized DAOYO screening and referral systems in healthcare connect patients to essential resources, improving outcomes. To sum up, South Dakota O are foundational to public health, explaining much of the variation in health outcomes and disparities. Addressing SDO through evidence-based, upstream, and intersectional policies, implemented via multi-sectoral partnerships and authentic community engagement, can reduce health inequities for all. To conclude, equity-focused SDO policies must be tailored to the needs of specific populations and informed by intersectionality. Upstream interventions, such as expanding social benefit programs, investing in early education, improving housing and neighborhood conditions, and addressing structural racism, are most effective when implemented through multi-sectoral partnerships and with strong community engagement. These strategies are essential for reducing all communities'